What if I told you that, years before the world grappled with the realities of a global pandemic, scientists had already envisioned a scenario eerily similar to what unfolded? A detailed, hypothetical exercise designed not to predict the future, but to prepare us for it. The SPARS Pandemic 2025 to 2028. We previously shared a two-part video series on the SPARS pandemic simulation. And now, we're wrapping it up with part 3, but this time as an audio podcast. It's a deep dive into the full scenario, designed for anyone who prefers to listen on the go. Even if you haven't seen the first two parts, don't worry, this episode brings everything together in one place. It's the final chapter of the SPARS series, and it covers everything you need to know. In 2017, the Johns Hopkins Center for Health Security crafted a futuristic scenario titled, the SPARS Pandemic 2025 to 2028. This wasn't a prophecy, but a tool, a means to explore the complexities of pandemic response and communication. As we stand in 2025, let's delve into this simulation, unravel its narrative, and understand its profound implications. It began in a place familiar to many, St. Paul, Minnesota. In this crafted scenario, by 2025, a novel coronavirus, dubbed SPARS-CoV emerged, catching both the public and health officials off guard. Travelers returning from Asia exhibited severe respiratory symptoms, leading to the first identified cases. The Centers for Disease Control and Prevention, CDC, swiftly stepped in, collaborating with state health departments to trace the virus's origins and contain its spread. CDC confirms the victims were infected with a novel coronavirus, SPARS-CoV. The virus spread rapidly, with cases surfacing in major cities across the nation. The public's anxiety grew, fueled by a lack of information and the rapid dissemination of rumors. The CDC, alongside other health agencies, faced the monumental task of not only combating the virus but also managing the narrative, ensuring accurate information reached the masses amidst a sea of misinformation. While SPARS was a fictional construct, its trajectory bore striking resemblances to real-world events. The challenges of developing diagnostic tests, the race for effective treatments, and the hurdles of vaccine distribution mirrored the obstacles faced during the SARS-CoV-2 pandemic. The scenario underscored the importance of preparedness, highlighting how prior experiences with outbreaks like SARS and MERS informed responses to novel threats. The CDC finds SPARS is transmitted through respiratory droplets and recommends that everyone practice hand hygiene and frequently disinfect surfaces. Experts learn that SPARS has a long incubation period 7 to 10 days and that it can be spread by asymptomatic carriers. Pregnant women and those with underlying conditions like asthma and emphysema are at a higher risk for complications and death. The WHO begins to recommend social distancing and isolation of suspected cases. There is hope that an existing antiviral drug could help treat SPARS, but there have been no randomized controlled trials. The US FDA issues an emergency use authorization for this drug to treat SPARS patients. Soon, there is high public demand for the drug and millions of doses are dispensed from the strategic national stockpile. However, it soon becomes apparent that the drug can cause serious side effects. Things become political. America is more connected yet more divided than ever. Rumors and misinformation regarding the virus and potential treatments circulate on social media. The economy takes a hit as the pandemic drags on. Within a year, a potential vaccine begins expedited review and there are promises that tens of millions of doses will be available within a few months. The simulation emphasized the critical role of clear communication. Public trust hinged on transparent messaging from health officials. Missteps in communication could lead to public skepticism, resistance to health guidelines, and the proliferation of conspiracy theories. The scenario showcased the delicate balance between urgency and accuracy, a lesson that became all too real in subsequent years. Let's take a look at the role of the CDC in global collaboration. Central to the SPARS scenario was the involvement of the CDC. Tasked with leading the national response, the agency coordinated efforts to develop treatments, implement public health measures, and guide state and local health departments. Their role was pivotal in shaping the public's perception and adherence to recommended guidelines. Internationally, the scenario highlighted the necessity of global collaboration. Viruses recognize no borders, making it imperative for nations to share data, resources, and strategies. The World Health Organization and other international bodies played crucial roles in facilitating this cooperation, underscoring the interconnectedness of global health security. It's essential to reiterate, the SPARS pandemic 2025-2028 was purely hypothetical. Crafted as a training exercise, its purpose was to allow public health officials, policymakers, and communicators to rehearse responses to potential challenges. By simulating a plausible pandemic, stakeholders could identify gaps in preparedness, refine communication strategies, and enhance coordination mechanisms. Such exercises are invaluable. They provide a sandbox environment to test responses without real-world consequences. The insights gained inform real-world policies, ensuring that when, not if, a new pathogen emerges, humanity is better equipped to respond. Reflecting on the SPARS scenario offers a mirror to our current realities. It underscores the importance of heeding scientific foresight, investing in public health infrastructure, and fostering public trust through transparent communication. The challenges depicted in the simulation, vaccine hesitancy, misinformation, logistical hurdles, are not confined to fiction. They are challenges we face today and will continue to confront in the future. Reading the SPARS pandemic scenario is like reading an account of the COVID-19 pandemic. But the scenario wasn't an attempt to predict the future. Rather, it was meant to illustrate a broad range of serious challenges that public health communicators might face. The hope was that by working through these challenges as part of a training exercise, federal, state and local agencies would be well prepared to respond to a similar scenario in the future. As we navigate the complexities of global health, scenarios like SPARS serve as both cautionary tales and guiding lights. They remind us that preparation is not about predicting the future but about being ready for it, in whatever form it may take. I appreciate you joining me on this exploration of the SPARS pandemic scenario. Remember, while this was a hypothetical exercise, the lessons it imparts are very real. Stay informed, stay prepared, and above all, stay vigilant. If this exploration resonated with you, consider sharing it with others. Subscribe for more deep dives into the intersections of health and science. Until next time, keep questioning, keep learning.